Hello and good afternoon. I'm Adrian James. I'm the Registrar of the College and President-elect. Welcome to this, our 6th weekly webinar. And the subject of this webinar is workforce wellbeing. We've got 3 really great speakers, and there'll be an opportunity for you to ask questions and to get the answers as we go along. There is a tab on your screen which is a Q&A tab. If you type your questions into those, we'll gather those together, perhaps get some themes, and then I'll ask each of the speakers at the end of the session to answer those questions. If you have more general questions, we do have a Q&A tab on the website, and in fact that is the first post actually on the Q&A bar down the right of your screen. So if you have more general questions about COVID-19, we've got a team in our policy department who are answering those questions as we go along. So if you could confine the questions today to the subject matter of workforce wellbeing, because it's so important. We've got 920 of you who have joined this webinar, so it's great to have such a big audience. Before we start and I introduce our first speaker, I've just got 3 things I wanted to say. First of all was a really big thank you to all of you for the work that you're doing under really very difficult circumstances, whether you're doing face-to-face work, PPE, with patients, or whether you're working remotely, or even if you're shielding. Everybody is contributing in a huge way, so a very big thank you to all of you for that. The second, I wanted to draw your attention to the college resources on COVID-19. They're mostly on the website, but there's some webinars, these webinars every week, but we've got subject-specific or specialty-specific webinars run by the CCQI and the NCCMH, and they're also available. I tuned into one only this afternoon around safety and COVID, run by Helen Smith and Nakul Talwar from my own trust, Devon Partnership. So please do make use of those resources. And the third thing is about our members survey. We've just closed the most recent survey, but every 2 weeks we're asking questions about PPE, about the Mental Health Act and other relevant matters. And our next survey, which will be in a couple of weeks' time, will include a section about the really important issue of Black, Asian and minority ethnic members and their experience and their particular needs. So please make a special effort to respond to those surveys, because this gives us the evidence that we need to speak to policymakers. So it gives me great pleasure to introduce our very first speaker, and she is Dr Sonya Wallbank. Sonya is Head of NHS Culture Transformation, and she has now leads on COVID-19 clinical health and wellbeing for NHS England and NHS Improvement. And I know she's been working very closely with many of our members on this. So Sonya, thank you so much. We're very lucky to have you. So over to you, Sonya.
Thanks, Adrian. Great to be here. So I just wanted to start just to give you an overview of the evidence base that we're working on for our response to health and wellbeing. We convened an expert task force, all of which had been clinically involved in some way or another with single incident events, so things like Manchester bomb, London bomb, or the kind of broader pandemic work around Ebola, and longer emergency responses, so thinking about 9/11, the Boston bombings. What we wanted to do was really understand the model that we were working within, and so we've adopted the sort of stress and trauma response. And we've come up with a framework that we've affectionately called PAR. So the idea of, in the first instance, preparing our staff teams for what was to come has been really significant. And as we move into the recovery zone, again, preparing staff for what trauma looks like, what the impact of having done this work might be, again, will be important. The active phase, which depending on where you are in the country, will be a different experience for you. in the eye of the storm, it's very difficult, as you're probably aware, to pay attention to your own health and wellbeing needs. So really not anticipating that staff would be taking up offers of health and support in that period of time, but just letting people know that paying attention to your physical wellbeing needs was critical. And now, as we move into the recovery and restoration, I think it's called now, R&R, really wanting people to start spending some time thinking about what might this look like for you, what might this period have been like, depending on where you were, whether you were in the front line, providing staff care or further beyond. Your contribution will be important and your impact will very much vary. Thanks. If I can go to the next slide. So what we've ended up with is a suite of offers that we're improving each day. So we've got a listening line that the Samaritans are helping us man. We have a text service which Shout provide for us, just text frontline to that number. And then a specific bereavement and loss support line through Hospice UK, which will give you access to 3 free sessions around end-of-life care issues and support. Our people.nhs.uk website is full of materials aimed really at the resilience of the team. So we know that beyond any of the offers that we offer, and obviously this is a national programme that builds on the local support that people will have access to, we want to ensure that teams are paying particular attention to the health and well-being of those members within it. Each week, it's not a very good slide actually, the colours are distorted, but each week we have a set of health and well-being webinars, and again those have been well attended. We have 4 apps that we've got free access to, again around sleeping and that kind of general well-being, but also a self-guided mental health support modules with Silver Cloud. So they are based on anxiety through COVID. So we've adapted those, because if you think of the specific advice we'd been offering before, it was all about getting out and about and not being socially excluded. And then this week we've launched the Common Room offer. So these are manned by a psychological professional, but to have conversations in a peer support guided way. So that's the latest set of offers. If we go to the next slide. So talking to a range of people where they're offering wellbeing helplines, we haven't seen a huge uptake, not unexpected at the moment. We're probably going to see a second surge as we move into recovery. The text helplines about 800, and again thinking of peak hours, people coming off shift later in the day. What we have seen, and all of the third sector colleagues that I speak to have seen, is a real push towards self-help materials. So people really wanting to take care of their own mental health and well-being insofar as they're able to, which is very positive. So again, we're looking at how do we get this information out to local teams and organisations so that they're able to equally play their role here. Just what we're learning over the last couple of weeks, there is a real rush to jump in with psychological intervention, and all of our trauma advice, being a psychologist myself, has been really useful in that, you know, we need to watch and wait, we need to intervene when the time is right, and if we leave people, not everybody will need intervention, and really getting that message out to service is really significant, so that they're not commissioning things inappropriately. As the lockdowns continued, the sort of feelings of loneliness, hopelessness and negative thinking have increased, and we've got a bit of a concerning trend around suicidal ideation that we're looking into at the moment in terms of how we support that at a local level. Thanks. We can go on to the next slide. So this is just my interpretation of what we think is coming next. So coming out of the active phase, people's physical demands initially may reduce, and therefore that will leave space for a kind of psychological reckoning. What have I just been through? We know, looking at all of the system activity that's been put on hold, there'll then be a second peak of activity. This is going to be hard for some people because the clapping will have stopped, the flowers, the food and stuff that's being delivered to organisations at the moment will have stopped. And I think there is some public messaging to be done around giving people an opportunity to rest and restore, and not necessarily just returning back to hard work. As the activity demands, the usual activity demands begin to settle, we know then that there will be a group of people, and depending on who you talk to, between 10 and 30% of our staff who will need mental health intervention rather than mental health support. And the last slide, please. So this is just the beginnings of a recovery plan. So what we want to do is to enable each of our systems to really be thinking about how do you help the holistic recovery. This will be the first incident of its kind where professional and personal have met together. So the idea that supporting somebody's financial and physical well-being, their family interruptions and things that we've asked people to do have been really critical as we move forward, making sure that we're offering support for the whole worker and their family. So opportunities to listen, intervening when it's right. We've commissioned initially the text and helplines and the specialist support for a minimum of 12 months, and really want to make sure that we're learning about uptake for those services to see what moves beyond that. We know that local organisations are equally responding very well, so we're just monitoring that right now. We're talking with our colleagues in the mental health team about a specialist service for staff to access nationally from a mental health intervention perspective. So that will be coming online shortly. And then just a plug really for thinking about leadership style, that compassionate, supportive leadership, to ensure that staff are able to recover at their own pace in their own time without the artificial expectation of returning back to work as quick as you can. Thank you, Adrian. That's me finished.
You're on mute, Adrian.
Sonya, thanks so much for that presentation. It was very informative and good to hear. So we'll move on to our next presenter. Dr Mihaela Bucur is Associate Registrar for Wellbeing and Retention at the Royal College of Psychiatrists, and she also works as a consultant psychiatrist at Sussex Partnership NHS Foundation Trust. So Mihaela, over to you.
Thank you very much, and thank you very much for inviting me today. It is a privilege to contribute to discussions about workforce well-being alongside Sonya, Richard and Adrian. Next slide, please. The current crisis does not need any more an introduction. It transforms in a short period of time our individual lives and the lives of everyone around us in our communities beyond any expectation. It not only impacts on health and safety, it impacts on all the other aspects and determinants of well-being, impacts on workplace, social connection, economy, access to natural environment. Also, it brings at the forefront issues about equality, diversity, and inclusion, with data showing alarming results that people from Black, Asian, and minority ethnic population are disproportionately affected, and this is an emergency. So it has never been a more crucial time to focus on well-being at the individual and organizational level. It is fantastic to see a multitude of local and national resources, and Sonya illustrated the national NHS offer of well-being for staff. And it's good to see those developing more and more in the last couple of months, providing information, providing support, providing a space for reflection and validation of quite difficult emotions at this time. Because ultimately, we all want to remain well, and we want to be able to make a difference in our day-to-day work. And whether in crisis or not, we still aspire to thrive at work. But I'm sure you all agree this is, of course, one of the most challenging times with unexpected worries and concern that may impact on our fulfillment at work. Next slide, please. I'm sharing with you briefly a model that we use at our Wellbeing Committee at the Royal College of Psychiatrists. Of course, as you can see, it is greatly inspired by Maslow's hierarchy of needs, and it provides a guide, a framework of a self-reflection, of reflection with peers and in teams as well, on the aspects which are important and they can contribute to us thriving at work more and more. I'm going to take you very briefly through this model, and I'm going to illustrate with some examples which are now specific to the pandemic. Of course, it starts with the basics, and it starts with awareness about our current state of health. And this is very important. We know this is a time when we might experience stress, fear, anxiety, and those are understandable reactions. But it's equally important to acknowledge when we are becoming unwell, when our health is affected, and ask for support at that time and for the appropriate treatment if necessary. I think as doctors, we struggle to ask for help, and I think stigma is a massive challenge. And I think is a challenge, it's a more of a challenge at present, because we see every day our wonderful stories of amazing heroic acts of our NHS colleagues. We see that around us. So we might feel even more reticent to acknowledge sometimes we struggle, we are unwell, and we need support. I'm going to mention here, of course, part of the Wellbeing basics, the important self-care parameters. They are mentioned in all the resources, and they are essential. It's about nutrition, sleep, exercise, and using any modality which may lead to reduction in stress. Moving next to safety at work. Of course, a key focus is on PPE testing, and of course on the risk in Black, Asian, and minority ethnic population. The college has been proactive in conducting a series of surveys just to bring an objective picture of the current realities at frontline, realities we are facing every day. And I'm sure you all know that the results of the first survey, which was undertook in mid-April, has shown deeply worrying results, with a quarter of the members that responded not having access to the correct PPE, and half of the respondents didn't have access to appropriate testing. And Adrian mentioned earlier about the next survey, which is going to look particularly at the risk in Black, Asian, and minority ethnic population. But safety at work nowadays is not only about PPE and about testing. Many colleagues have been deployed working in unfamiliar environments, away from their usual team, from community to acute care settings, or covering a larger area or larger population. And working remotely come with its own risk. For example, the IT safety, easy access to MDT, easy access to supervision, to the chance to discuss a difficult case with the peers, having some time for reflection. They are all relevant to safety. Moving next to belonging and contributing, being engaged into current developments or current processes in relation to the current crisis are all essential. We are all isolated to a certain extent, but it's important we don't become disconnected. And this is essential, and we don't become lonely and facing difficulties while we are away from the team. It's also important to maintain our belonging to our profession, and to look at any opportunity of liaising with our peers, with our colleagues. And we know there are more and more examples and different trusts of Berlin groups or similar initiatives that can provide a safe space for reflection, for validating emotions. And we'll see more and more of those in the phase of recovery. Of course, thriving at work is dependent on being respected, valued, being professionally recognized, and that's an essential parameter as well. So all those elements, they can provide a guide or a framework for reflection, and can contribute to discussions that can lead to improvements. I think some of the things are under our control, and we can implement easy some of the changes. Some of them are not, and it's important to ask for help when that is the case. Next slide, please. I'm going to go now through a series of resources which have been developed at the college, and of course I'm going to start with the Psychiatry Support Service. This is a free service, easy to access, and provides confidential support and advice to psychiatrists across all career grades. I would like to pause here and say a massive thank you to all volunteers who got in touch with the college and offered to become trained and offer support to other colleagues through our support service. We estimate that the number will, of course, increase significantly over the next few months and years. Next slide, please. I'm sure everyone is familiar by now with the guidance for clinicians on the college website, and it also includes a section on well-being and support, which focus on advice on how to take care of ourselves. Also, very valuable information about how we can access national resources, materials, but also materials developed to guide us as a professional group in how we can support other healthcare professionals, as long as very important information about organizational well-being, which is paramount. And I think this is a document which was developed with the support of the Faculty of Medical Psychotherapy. And again, I'm going to take a pause now and convey the massive thanks to all the contributors to those documents, including Professor Neil Greenberg, Professor Simon Wesley, and Professor Richard Williams, as well as colleagues from the Faculty of Medical Psychotherapy. Next slide, please. Those are just examples of other resources available at the college, and of course the e-learning hub, essential in providing the right knowledge and skills into how we can support in a safe way our patients during the COVID-19 outbreak. And this is important not only for safety of our patients, not only for providing a high quality care, it's also important into giving us the confidence into supporting the best we can our teams as well. Next slide, please. I included in my presentation the information about the roles and work of psychiatrists during the pandemic. This is a statement which was produced by the colleagues. It's a very important document which highlights the current role and expertise of and how that can be used at present, and also highlights the particular role that psychiatrists are playing into supporting colleagues in general hospital or in temporary COVID hospitals, and it provides great evidence-based model on how this support can be approached, because we are all very happy to help and we wanted to make a difference, but we need to make it following evidence-based. Next slide. This is just an example of video material on the college website with Professor Richard Williams highlighting the top 10 messages for supporting our team, with a huge focus on, of course, kindness, supporting each other, supervision, very important, and enabling early support for our colleagues that struggle. Next slide, please. So next steps are very important, and I had discussed already about the ongoing emergency, about the risk in the Black, Asian and minority ethnic population. This is an absolute emergency. Of course, there are ongoing concerns in relation to PPE and testing. So the college is very keen to maintain and to promote engagement, involvement and inclusion of all members. So we are all very grateful of the queries that have been sent to the college and the question highlighted, and many of the resources that have been developed are based on the areas identified by members. Of course, we need to define what a good and sound recovery will look like, how the process of repair will contribute to us remaining well. But lastly, and not least, I think this is a great opportunity. This is an essential time to bring in every moment humanity at the forefront. It's important to be kind, to stay connected, and very important, please do ask for help if you struggle. Stay well and stay safe. Thank you very much. Over to you, Adrian.
Well, thanks, Mihaela, for giving us an idea about the framework that you've been using to address well-being and some of the content of what the college is doing. And I know even before COVID, we had ambitious plans, which we are going to follow through on to develop our wellbeing strategy. So it's never been more important. Don't forget to ask questions of our speakers, and we'll come to them at the very end. And so now I want to move on to our final speaker, Dr. Richard Duggins. Richard is consultant psychiatrist in medical psychotherapy. He's clinical lead for the Regional Department of Psychotherapy in Newcastle upon Tyne, and he's also clinical lead within the NHS Practitioner Health Programme, and that's an England-wide confidential self-referral NHS mental health and addiction service for doctors and dentists. So over to you, Richard.
So I'm delighted to be invited to present today, and I hope you find this helpful. Next slide, please. So for 13 years now, the majority of my clinical work has been in assessing and treating doctors. And today I'll be sharing key insights from this work. I'll cover the resilience puzzle, the performance cliff, and 3 healthy habits. Next slide, please. The resilience puzzle is we know doctors are highly resilient. They survive long and demanding trainings. They deal with disability and ill health on a daily basis. They regularly get knocked back, and yet they come back for more. And yet, doctors also suffer from high rates of burnout and mental illness, often described as the 4 Ds: depression, drink, by which I mean alcohol addiction, drug misuse, and death by suicide. For example, a female doctor is twice as likely to suffer from depression as the average person, and about 4 times more likely to end her life by suicide. Next slide, please. The reason for this resilience puzzle is the balance between resilience and burnout is complex. If we look at this very helpful pressure cooker diagram by the psychiatrist Laura Dunn, you can see on the left are the drains, the things that drain energy, stress, time, energy demands. On the right are the radiators, things that radiate energy, support, social and pleasurable activities. In the middle is the important influence of personality and coping styles, and I'll discuss these later. Next slide, please. I'm now going to talk about the performance cliff. I use any opportunity to talk about this to as many people as I can. It's so important because it's the characteristic presentation of over 70% of doctors who run into trouble with their health. There are 3 stages to the performance cliff. It starts with the plateau, where performance is maintained. And then there is the cliff, a rapid drop-off of performance. And finally, there's recovery. Firstly, to start with the plateau, this is where the doctor is increasingly struggling with stress, burnout, anxiety, and low mood, due to pressure at work or home, and most commonly both. Despite this, they maintain their work performance. The plateau is not a brief stage. It lasts typically between 6 months and 2 years. Next is the cliff, a sudden drop in work performance, usually resulting in ill health leave, occurring over a few days, usually taking everyone, including the sufferer, by surprise. This is when doctors tend to present to services. Finally is the recovery phase, lasting 2 to 6 months. At the end of the recovery stage, doctors often say they haven't felt so well for years. When I meet with a doctor with burnout, we often recognise 4 important factors have occurred as they've struggled along the plateau. Next slide, please. Firstly, under stress, a doctor tends to protect and prioritise their work. To do this, they increasingly withdraw from replenishing social and pleasurable activities. This leads to a snowball effect, a vicious cycle of increasing burnout. Secondly, under increasing pressure, doctors tend to rely on certain coping mechanisms, namely minimisation, rationalisation, and denial. We are all trained as doctors to keep calm and carry on. But this attitude of burying things under the carpet means we do not address the underlying problems and stresses, and we do not reach out for support or help when we need to. Thirdly, doctors' personalities tend to encourage taking on personal responsibility and having high personal expectations. These personality factors are a two-edged sword. In normal times, they promote high quality care, but under stress, they can lead to feeling personally responsible for all of the doctor's problems and having too high personal expectations. This can result in the doctor feeling their problems are theirs and theirs alone to solve, and not feeling able to reach out for much needed help and support. The final important factor is organisational culture. This is very important in the plateau. We know doctors find it hard due to their personalities, shame and stigma to reach out. An organisational culture that normalises support and help seeking and decreases blame and guilt can make so much difference. Curious and courageous colleagues who offer support can also be so valuable. Next slide, please. I'm now going to share the 3 healthy habits. I work with doctors who do very good things in very bad times, and there's much I've learned from them. I recognise 3 healthy habits that lead doctors to recovery. Next slide, please. First habit, healthy habit 1, is healthy serious. Doctors are very good at treating patients, but they start to recover when they turn some of that focus on themselves, when they stop ignoring problems and address them, when they dedicate time and energy to this and divert time and energy away from things that are not helping for now. They are realistic about what can be managed currently. They engage in treatment if required and make steps to access this. Next slide, please. Healthy habit 2 is health is a team and contact sport. Here, doctors start to reach out to others. They move from independence to interdependence. They take support from others, and they restart replenishing activities that are good for them. Next slide, please. The third healthy habit is health is in the important things. Doctors here start to focus on what matters. They rediscover the nourishing activities that may have been lost in the busyness of life. They are clearer about their personal needs and more assertive in meeting them. They regain a balance often between work, family, social and spiritual life. Next slide, please. So as I move towards a close, I wanted to show you another possible journey. Earlier, I said over 70% of the doctors who come to see me show the plateau, cliff and recovery pattern, but not all do. Some identify problems early on the plateau. They do not withdraw, they reach out. They start the 3 healthy habits early and they nip something in the bud and they avoid the cliff. Next slide, please. Finally, how does the balance of burnout and resilience stack up in the time of COVID? Let's look at the pressure cooker again. Next slide, please. To take health seriously, we need to be aware of the current temptation to work longer hours or not take annual leave, the more fluid work-life boundary of home working, the exhausting adaptations that we're having to make in our working lives and often quite quickly, the pressures of looking after children at home or worrying about parents, and the fact that we may be conflicted because work may no longer feel safe. As health is a team and contact sport, we have to adapt when we have less contact with our colleagues and our social activities have changed. And as health is in the important things, we need to work hard and be creative when our replenishing and stimulating activities have changed. Next slide, please. So today I've talked about the resilience puzzle, the performance cliff, and the 3 healthy habits. Thank you, and I'll hand back to Adrian.
Well, thank you, Richard. It's great to get the benefit of your huge experience in this area, and I think the 3 healthy habits are something that I've made a mental note of. So thank you to all our speakers. We've got a number of questions, and in fact, I'm going to just answer the first 2 because they're relatively brief. In fact, our very first question was about my T-shirt. I hope you've all noticed the college crest, and people are asking, where can we get one? They are available from the college. There's actually, I bought at the International Congress. So there's actually a lot online about etiquette for online meetings. I recommend the college crest gets it just about right. Not too formal, not too informal. The second question was about the slides. People have commented on how good the slides are and are they available. I mean, better than that, the whole webinar will be available on the website. You can watch it again at any time or post links to other people you think will benefit from them. And actually, we can send out a link to the slides as well. So you'll have 2 opportunities to look at these again. So again, thank you to our speakers for those. So I'm going to move on to questions to our speakers, and in fact I'm going to go to Sonya first. In fact, Sonya, I'm going to ask you three questions because they're related. One was, are the support options available UK-wide? I would imagine you're in contact with the other 3 nations. How much of ours are available for the English ones across the 4 countries, and do you know anything about what is available there? Also about non-NHS workers. I mean, a lot of the issues that are there for NHS workers are there for those who aren't employed by the NHS. What about their needs? And a third question about full leave entitlement. Is there a guarantee on behalf of employers that people will get their full leave entitlement? So Sonya, over to you for those 3 questions.
Yes, so we are working closely with our partners in Wales, Scotland and Northern Ireland. As you can imagine, the governance arrangements are different across the countries. All of our offers are available England-wide, and then we know that all of our partners are looking, if they're not online already, are doing something very similar with different arrangements. A lot of our offers are related to our partner arrangements with people like Samaritans and Hospice UK. So some of our hesitation has been just about their capacity rather than an unwillingness on our part to spread those offers. In terms of who the scope is for the offers, so anybody delivering NHS care are eligible to participate in the offers. So it doesn't matter who your employer is. So thinking of porters, reception staff, you know, if you're on a contractor basis, agency staff, you're still enabled to access these offers. And social care, I believe their package was soft launched this week, but it's a mirror of the package that we're offering. And I know that the line goes live, the helpline goes live on Monday for all of social care staff. So again, we're trying to be very inclusive, recognising that it's not just NHS staff, particularly that would be affected by this. In terms of holiday, I wouldn't be the kind of lead source on that, but I'm going to take a flyer and say absolutely. We were talking yesterday about the reluctance of people at the moment to actually take their holiday, because of course, what are you going to do? So we're hoping that with the slight relaxation on Sunday that we're expecting in kind of lockdown arrangements, that people feel keener. We know that people are looking tired, you know, everybody's kind of moving towards a sort of burnt out state because people have been working so hard. So it's really important that people not just are entitled to their leave, but they actually take it.
Okay, thanks for that, Sonya. We'll make sure that on the college website that we've got links to the support that's available across all 4 nations. So we'll make sure that that's there. And I mean, in relation to leave, my own organisation, Devon Partnership Trust, have had a system where people could roll over as much leave as they wanted. Of course, this went into the previous year, and have been very flexible about whether people are paid for extra days or whether they actually are added to their leave. So I think there has been a fairly universal, flexible approach, but that may be something in discussion box at the member survey. If there are particular issues with that, we'd like to hear about them. The next question I'm going to put to Mihaela. And Mihaela, we've had a question about the balance really between us as mental health professionals, psychiatrists, but really I guess across the whole of the health service at this time, of that delicate balance between keeping your psychological distance, but actually maintaining empathy. Can you give us your thoughts on that, Mihaela?
Thank you very much. It is a difficult time, and I think balance is very important. It's important that current crisis is not going to impact to us to a level where it enables, it keeps us, it brings us to a space where we can't function anymore. However, we need to acknowledge that some of those emotions are normal, and it's a normal reaction to feel stress and anxious and despair at times. Is what do you do when something like this happened? And it's nothing as important as keeping connecting, and keeping connected not just with the family, not just with our own individual communities, keeping in touch with the others. And I think it's a time when we can offer support more than before, and sometimes, for example, working remotely, it can come with its own challenges in maintaining that connection. So I think we need to be even more proactive than before, and I think there is a particular role particularly for supervisors, for team managers in promoting this. And I think engagement and communication is a two-way avenue. Of course, it's important to be kept engaged and to be able to connect with the team and with our peers as soon as we can, but we need to be able to do that ourselves as well, and to offer support to our trainees, to our peers as much as we can. And I think things might be even more difficult at times down the line. I think everybody has a unique experience of this crisis. As I mentioned in my presentation, it just affects all the aspects related to well-being, and all of us, we perceive it in different ways. So we may be in the same team, but each of us has struggled in a very different way. So trying to understand the other and enabling enough space to recover and repair following this is going to be essential. I know the college is working on producing some guidance about how good parameters of recovery would be, and that includes about how we can attend to our own psychological safety, and how we support and enable the others to remain well. Thank you. Over to you.
Okay. Thanks, Mihaela. That's very helpful. The next question is going to be to Richard. Richard, what about those who were severely burnt out before COVID-19? What services were available for them, and what might be available for them going forward? Richard.
Yeah, thank you. I mean, this is a really important question, because there was, if we go back to my talk, there was lots of doctors who were struggling along the plateau, and then COVID-19 hit. And for many people, that has felt too much, or will feel too much, and will push them towards the cliff. I suppose if we talk about the services, I mean, the college resources that have been signposted are there on the website. But just to kind of go over a few of the big ones. NHS practitioner health for doctors and dentists in England, self-referral confidential service is an excellent service for doctors and dentists with psychological distress or addiction difficulties. We've got the psychiatry support line, which people can talk to. We've got the BMA counselling and Doctors for Doctors service. In Wales, we've got the Health for Health professional service, which is open for doctors, which is excellent. It's also important not to forget what might be available locally, and I think when you have a good occupational health service, it can be like gold dust, and people, you know, I think doctors particularly don't use their occupational health service quite as often as they perhaps would benefit from. So that's what I'd say, Adrian.
And Richard, Richard, one more question for you. We had a request that could you say a little bit more about the practitioner health programme generally? Who's it for? How do you access? What's available? And what about the outcomes and the key issues that arise?
Oh, yes, I'd be delighted to have the opportunity to talk about I'd be delighted to have the opportunity to talk about the practitioner health programme. So it's a service for all doctors and dentists. It's funded directly from NHS England, but it's an NHS health service. So it's there for the doctors and dentists to come through, and it's for psychological well-being and for people with addictions and alcohol difficulties. We have no. It's a very confidential service, so people's information is kept confidential. People can self-refer. The way to self-refer is to go and visit NHS Practitioner Health, the website, and you can either refer yourself by telephone or through a form on the website. What we offer is you can choose to meet with somebody locally in England. Unfortunately, this is only an England service. Somebody locally in England, either a psychiatrist or a general practitioner with specialist interest in mental health and addictions. You can choose who you want to meet with, and they will offer you an initial comprehensive assessment, and they can also offer you follow-up and further management. And through that, we can also, if appropriate, access brief CBT and brief psychotherapy, and a whole suite of excellent support for addictions and alcohol if that is needed. It's a good offer. The outcomes are absolutely astounding. We know doctors, when they access appropriate health, do incredibly well. There are a cohort of people who do incredibly well. So if you look at the addictions results for NHS Practitioner Health, we get at 5 years, we've got about for alcohol dependence, we've got about 80% or more of our alcohol dependent doctors are abstinent at 5 years, which is an absolutely astounding result. And that's married with the other results with the kind of mental health outcomes too. So people can expect to do very well, and they do very well. Does that answer enough, Adrian?
Yeah, that's great, Richard. Thank you so much. The final question I'm going to put to our speakers, I'm going to put that to Mihaela and also to Sonya, is a question we've had about the changing roles at the time of COVID, that many consultants are spending much of their time in leadership positions now, supporting teams, and how will this sort of pan out in terms of their clinical responsibilities over the next weeks and months, and how should they balance those responsibilities? So Sonya, first to you, and then Mihaela.
So I think there's a couple of points. So we're talking a lot with teams this week about actually we've quite enjoyed this new work that you've given us. We've entered into a team, we've got a really nice pace going, so that sense of loss returning back to what is the standard work is something to think about with teams. Some of the negative sequelae around the work that I've been doing has put me in a position where I've had to make difficult and different decisions, is also to be worked through. And just the leadership role that people have taken, it's that really emphasising that there needs to be a period of transition. So whether it's a step down to different work that you're going to be doing, or really thinking about the fellow team members around you who may have enjoyed your leadership time, just taking some time to think about the impact not just on yourself but the wider team would feel critical.
And Mihaela.
Thank you. Thank you. I think many of the colleagues that took leadership roles really enjoy the chance to make a difference, enjoy the chance to implement innovations in a much faster way, and certainly some of those innovations are going to continue. I think certainly this current crisis is going to change many things, and perhaps will make each of us more avid to contribute at times to different developments. However, it also had an impact how we rearrange our roles and responsibilities within teams, and it showed that actually with varying degrees of leadership, many of the colleagues can make a difference, but that also enthused the other members to take steps that led to amazing results. It might be difficult when things will return to the usual thing, but I think it's important to channel some of this, channel some of the enthusiasm. And there are many opportunities to continue to contribute. And I think all of us should step into being more innovative. And I think it's part of thriving at work. And I think we all need to be supported into making more decisions at the front line. And it's such an important aspect. It's part of leadership is part of our profession as well, and I know the college highlights many opportunities for QI as well, which is well implemented in so many of the trust. But I think it's a positive aspect, and I think it will be managed well. I think supporting innovative solutions should be part of everyone's day job, and I'm sure we'll remain with a lot of this to inspire us in the future. I think we should do more of it. Thank you. Over to you.
Okay, thanks, Mihaela and Sonya. There are two more questions that I was going to address, and actually I'm going to respond to them. The first is there's a question about the increased need for psychological services post-COVID and what contact we've had with the government over that. I'd want to expand that to say that we already had plans to look at lobbying the government for more resources to finally actually bridge the parity gap. And my plan has always been to develop a clear sort of roadmap to parity. What's the workforce? What is the resources that we will need in order to bring about parity? And what will that look like across all the different branches of psychiatry? And of course, this is an extra importance with COVID. The Secretary of State said that the government would fund all the NHS needed to deal with COVID-19, and the mental health effects of it may be over quite some considerable time. So I will certainly be holding the government, and actually the governments, to account for fully funding the need that arise from COVID, but actually using that as an opportunity to look at the gaps that were already there. I'm a member of the Academy of Medical Royal College's group that's actually looking at the recovery plan and what that needs to look like. So we will be doing this over the coming weeks and months. There'll be individual meetings and lobbying, but also groups that will be coming up with plans. The second question I wanted to deal with was about college members working overseas, and one of the, I think, the amazing things that COVID has brought about is a sense of the global community in psychiatry and mental health. I've been in contact with colleagues in Hong Kong, in Italy, in Germany, across the whole of Asia and Australia and the United States, and actually people have very quickly swapped their ideas about what's actually happening, lessons to learn. I had some great information from Hong Kong very early on from Roger Ng, and it has brought us together as a global mental health community. All our resources on the college website are available to all our colleagues globally, and they can phone into these webinars. And in fact, the next webinar on the 14th of May, it will bring an international perspective, so there'll be more answers to this. And actually, I had a contact from one of our members in Ireland earlier on about our survey, which actually just covers the 4 UK nations, and we're going to lend the questions to the college in Ireland so that they can ask the same questions of our members there. So there is a lot of engagement. It is really very important, and COVID has really brought that community together. So that brings an end to our session today. I'd really like to thank our 3 speakers, Sonya, Mihaela and Richard. I'd also like to thank our producers. We've got a college team behind these webinars, so Isabel, Emma and Katie, a big thank you to you for keeping us all in order and the preparation. So thank you so much for that. The next webinar will be about international matters. The one after that, working on the front line, so getting some real live experiences. So I'm going to close there. It's a bank holiday weekend. I know that many of you will be working throughout the bank holiday weekend. Again, thank you for all you're doing. For those of you who do manage to get a break, use it well. And I'm going to take the words that Mihaela used: be kind, stay connected, but ask for help if you're struggling. So thank you very much from all of us, and thank you for your questions and all you're doing. Thank you and goodbye.